Good afternoon. My name is Dawn Steinman, and I am a student in the Kaplan Nurse Practitioner Program. Today I am going to do a head-to-toe assessment on my patient, Allison. Thank you, Allison, for helping me out today. What I am going to do is start at her head and work my way down, and if I find any abnormalities or anything like that, this is something that I would have to address at the end of the examination. This examination will take close to 45 minutes. We are going to do a thorough head to toe. So, do you have any questions before we get started?
Not right now.
Okay.
Thank you.
When Allison first came into the clinic, I had her obtain her weight and her height, and I also did a set of vital signs. And everything was within normal limits. I would have checked them against her chart if she's been here a patient before and made sure that everything was in her normals. I would also have, before I met her, reviewed her chart, made sure that her medications are current and up to date, any health problems she's had in the past, any previous immunizations or hospitalizations or any problems. If she has just recently gotten over being ill, cold, flu symptoms, anything like that, before I ever met her. Then when I first meet her and am escorting her to the room, I would want to be checking her gait, her appearance, whether she is well groomed, if her clothes are neat and clean, and be paying attention to how she responds to me, her facial expressions, and go from there. Okay. Good afternoon, Allison.
Hello.
Is it okay if I call you Allison?
Yes.
Okay. My name is Dawn, and I am going to assess you today.
Okay.
Okay. Any questions before we get started?
Not right now, but I'll let you know.
Okay. First thing I'm going to do is I'm going to put on some gloves and I'm going to assess your head.
Okay.
When I am assessing her head, I am looking at her hair pattern, her texture of her hair, the thickness of her hair, and if there's any presence of any parasites, lice, anything like that. So, I kind of start down around the ears. Okay, everything looks good. Okay, then I will get in front of her and I want to just look at her face. I'm looking to see if the facial features are symmetrical. I want to see if her eyes are at the same distance, if her nose is deviated to one side or the other. I want to see if there's any drooping on one side of her mouth or anything like that. So when I'm doing this, I'm going to ask her to do a few little steps. Allison, could you smile for me? Could you grit your teeth? Okay, can you wrinkle your forehead? Good. Stick out your tongue and puff out your cheeks for me. Okay, this is checking cranial nerves 5 and 7, and everything seems to be fine. Okay, the next thing I want you to do is I am going to take a little piece of cotton, and can you feel that?
Yes.
Okay, I'm going to have you close your eyes.
Okay.
And with your eyes closed, I'm going to touch this on your face, and I want you to tell me if you can feel it.
Yes. 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 Yes.
Okay, good. So, her cranial nerves are intact that way. Okay, next I am going to have you remove your glasses.
Okay.
And I want to just kind of take a look at your eyes. Okay, what I'm looking for here is if there's any redness in the eyes, any presence of conjunctivitis, whether she's having any troubles with focusing or anything like that. I will take my pen light and I want to check your pupillary response. So, in a dim room, I would start to the side and quickly flash my light onto her eyes. What I'm looking for is whether the pupils are reactive and equal on each side, And I'm also looking for what is called the corneal light reflex. If I did not see the corneal light reflex, I would do what they call a accommodation check. And to do the accommodation check, I would have Allison take a card and put it over her eye, and then I'm going to put the card over my eye, and then I'm going to have her watch my finger. And if she can't see it in the same field that I can see it in, then there might be a problem. Can you see my finger up here?
Mm-hmm.
Reach up and touch my finger. Okay. Now let's change the other eye. Same thing. Can you see my finger?
Yes.
Good. Okay, that is the accommodation check. Okay, so now I am going to check her sinuses. I'm going to feel across her sinuses. Allison, if you have any pain, please tell me. Any discomfort?
No.
Okay, now I'm going to look at her eyebrows. They are symmetrical. And then I'm going to have you open your eyes and look straight at me. And I'm going to kind of palpate your lacrimal ducts here. There's no puffiness, no discharge, anything like that, so that's good. Okay, now I am going to take my light here and I am going to check her eyes. Now what I'm looking for is the red reflex. And then as I see the red reflex, then I will get a little bit closer with my light and I will check to see if there's anything wrong with her cornea and the vessels in her eyes. Okay, and you do that for both eyes.